how much of a change have you made as a state legislator, and how much of a bigger impact do you think you'll make as a governor?
A lot and a lot.
Okay.
So we started counting the bills that we passed since I arrived. And I believe we counted 22 was the last time, and that was before this previous session. So I would say very close to 30 bills.
Wow.
And some of them are, we think of solutions sometimes like we do in business, right? You get everybody in a room, you start a process, you look at whiteboards, you do a little brainstorming session, you get everybody there and you start working on a plan, and then you do it. Well, you can do more of that as a governor, but as a state legislator, we typically work on one subset of this, or one subset. For instance, we did a very small subset, but important subset this last session. I'll give you, this is probably one of the most obscure ones, right? For severe cases, people who would be committed non-voluntarily, maybe by a nurse, or maybe by, maybe they're in a facility already, and they say, okay, he's or she is experiencing some major issues that we can't handle here. We're going to commit this person to a hospital, for instance. And by the way, this bill came from one of my mentors, my healthcare mentors. And the problem was many of these people would be treated, and then they be streeted, as they call it, where they're released by the hospital. The hospital would notify the parents or family members, their organizations. There'd be nobody to pick them up. Sometimes if you're in that situation, sometimes there have been burned bridges. And so you may or may not, or just disconnection. And so you'd have to, so they'd literally show back up a week later, or on the street somewhere, they'd be streeted effectively. And so how can we help that little segment? Well, it's interesting that we actually had to write a law for this, but give them 15 days of their medication, make sure they have that on them before they leave, make sure they do a suicide check, make sure they have the written instructions, make sure they've contacted a family member, make sure they've contacted their ASO, so that there is a plan leaving the hospital so that they don't have that revolving door and end up back here rinse and
that
repeat.
That blows me away that there wasn't already a plan. I mean, you're talking a medical center that's supposed to treat somebody, and then they just release them, catch and release, kind of let them go. And
yeah,
wow.
And so much of our mental health care system, unfortunately, is in the hand of law enforcement because, like I said, these guys are streeted. And
is that a part of our homeless problem, do you think?
That is a large part of our homeless problem. And so what we tried to do, we called it putting a stick in the spoke of the wheel, that revolving door, putting a foot in the door and trying to stop that revolving door.
And that was this last session?
Yes.
And that passed? Was it signed by the governor?
Signed by the governor. Okay. And that's, when I say a subset, that's just one small slice, right?
Right.
Then there are the other bigger ones where that most people understand easily, where we give incentives for healthcare, for psychiatrists, for mental health, behavioral health professionals to stay here in Iowa for 5 years. And of course, and I always say this because I am also a fiscal conservative, right? And the state does come out ahead even when we incentivize people to stay here 5 years. And even if they left after 5 years, we as a state are still further ahead by keeping them here that 5 years. And we give them 5 years to fall in love with Iowa.